It's a pleasure to be here with you guys this morning. One of the things that when we started talking about me coming over and talking, it was, what do you want to talk about? Well, I want to talk about all kinds of things in healthcare, and we kind of ended on a little bit about leadership. So out of idle curiosity, tell me how many people in the room are currently working in the healthcare industry? Tell me how many people in the room want to work in the healthcare industry? So what kind of jobs do you want to have? What do you want to do? CEO, CFO? Eventually?
Time to speak up, guys.
Come on, if you don't talk to me, don't I go to them and talk to them?
Thank you.
Performance improvement specialist.
Okay, so in the quality arena, good. We'll talk a little bit about that this morning. And as Dr. Corey mentioned, I'm pretty active with TNCPE, which is our state level Baldrige program, and the Virginia program, and then the national. And happen to believe strongly, if you do nothing else for your professional development in the next several years, consider becoming an examiner in your state program. You will learn so much about the framework for organizations, it's not funny. So quality improvement, what else?
Community liaison.
Okay, in what arena?
I don't know.
So community liaison from a
Hospital setting.
Okay, from a healthcare organization to perhaps either populations in the community, etc. Okay. Okay. So a good knowledge of the community, the people you serve, their key customer requirements and what their needs are, and their needs and their wants, and those are very, very different. What else? Anybody else? Okay. Then you're going to be forced to have what the world, according to Tom, the way Tom wants to give it. So what I really wanted to do is I put together several slides just to kind of set the framework for what's going on in healthcare today. And in doing so, my thought process was, let's set the stage for what you all are going to need as you move into the future, and then we'll talk a little bit more, just kind of off the cuff, answer your questions about, so how do I get there? What is it I really need to know? What's important in today's environment? One of the things that was mentioned was I've been at this for a long time. I've been in healthcare for about 25 years now, and when I think back to healthcare now versus the 25 years ago, it has changed so dramatically, and it's gotten tougher, but it's gotten more fun. It's gotten more mission-driven, but at the same time, it's got a huge focus on the bottom line. So what I pulled out was just a couple of things to kind of set the stage for you, to tell you what our customers think about healthcare. 2008, Wall Street Journal, it was a story about a lady who was sitting in the emergency room, and she died in the emergency room. 6 hours before someone actually noticed the woman was dead in the emergency room. Now that story went viral. That hospital, do you think they wanted that kind of story out there? Absolutely not. Can you see how it happened? Your first blush is like, really? Someone actually died and we didn't notice it? Well, maybe she was sitting over in the corner. It might have been a chilly evening in Chicago, and she may have been just seeking respite from the cold. And so everyone looked at her and said, oh my gosh, bless her heart, she's just sleeping because she didn't have anywhere else to go. But that's not what everybody talked about. What they talked about was the fact that someone died in the emergency room. Do hospitals want people to die like that? Does anybody want people to die like that? They don't. But it happens. And unfortunately, the stories that they tell about us aren't always the good stories. What do they tell? The bad. The average person tells 8 to 16 other people about their negative experiences. We very rarely will take the time to tell the other side of the story. So you're doing all this good work for on behalf of the patient, but it doesn't always get there. Anyone heard of Plaintree? Plaintree actually started in California in the late 80s, and it was a precursor to patient-centered care. And it sounds kind of odd that you have to think about patient-centered care in a healthcare environment, because that's what we're here to do, is serve the patient, or we're here to serve the customer, but it don't always get that way. Angela Terriot's husband had cancer, and so he went through the healthcare process. And what she said at the end of that process, in addition to losing the person most important in her life was, it was so dehumanizing. I couldn't get information. They put me in places that I didn't know what was going on. They didn't tell him what was going on. I never knew what to expect. It was like being in a prison. I mean, all those things she talked about, the healthcare delivery system. So she started a national program called Planetree. You can buy into it. It's a franchise. It can propel your patient-centered journey. Now, in our organization, we studied them, but we chose not to purchase the franchise because we wanted it to be more intrinsic to our culture. And so we didn't want someone else to tell us how to do it. We wanted to learn how to do it. But I put it up here just to make the point. You know, people across the country, whether you're healthcare or non-healthcare, are spending inordinate resources to establish a culture. Well, who makes that culture? Who makes it up?
Leader.
The leader starts the culture. Who else makes it up?
People.
The people. It has to be led from the top, and you have to have buy-in from the top. So when we think about healthcare leadership, if I'm a part of an organization that doesn't get into either service excellence or patient-centered care, that's not going to be the organization I want to be in. The last story I pulled out just to kind of frame kind of where we're going, and again, what people say about healthcare, is the Josie King story. Anyone know about Josie King?
No, but she's pretty.
She's a cute little girl. So, Josie King in Maryland, Johns Hopkins in Maryland. Josie King was a 2.5-year-old child playing out there doing like 2.5-year-old kids do. Went to the hospital because she started getting sick, and they put her on a couple of different regimens. Well, over the coming days, Josie King started to become worse and worse and worse. The mother kept talking to the nurses, kept talking to the doctors. Something's wrong. You're not listening to me. It's not the way she actually responds. We need to change something. And in our healthcare, because I wasn't there, but our healthcare infinite wisdom, oh no, we've studied this. This is what needs to happen. This is what you need to do. Let's just give it a few more days. Well, in 2.5 more days, Josie King died. A 2.5-year-old child in our care, in a hospital setting, trusting the people that they were with, and she died. Now, after that, Josie King's mom said, you know what, this is not right. The voice of the patient, the voice of the customer we need to listen to. And I'm not faulting the folks at Johns Hopkins because they're world-renowned for their clinical skills. But we need to make sure we always listen to the voice of the customer and the voice of the patient. It's easy to second guess and be the armchair quarterback, but if you think about it, if that were your child and you had tried diligently to move forward, we failed that family. And we failed them because we didn't perhaps take a step back and say, what does it take to have the culture to do that? So what does all that have to do with leadership? Leadership really is a function of knowing a little bit about your culture, being able to move forward, being able to communicate that, being able to set the culture for your organization. So Dr. Corey and I were talking just briefly a little bit about the College of Public Health. And what she said was, we tend to be very student-centered in public health. And I would believe that. I've known many of you all who've been through the program, and I think that you are very student-centered. Is that the culture? Could you easily have gone to another university or gone online and gotten the book knowledge? Yes. But the culture is perhaps one of the things that brought you to this university. Inside Mountain States, we've spent, 20 years now building a culture. And that culture that we've been building, it continues to change, but there's certain foundational parts of the culture. For me, and the accolades sounded great, I'm not here in this community to do accolades. I'm here to have fun. And if you've ever worked with me and been around me before, if we can't have fun, we don't need to be doing it. Now, we can have fun doing some really serious things, but we need to enjoy what we do. We need to spend our life here doing things that we want to do. So when you say a community liaison between a healthcare setting and the community, you do it because you have an affinity towards people and you want to solve problems. That's fun. I heard the gentleman in the back of the room, the tobacco expert. 3 books now on tobacco. Tobacco is not a fun topic. Well, I guess maybe it could be, but it may not be a fun topic. However, do you have fun doing it? Enjoy doing it. It becomes your culture, it becomes your passion, what you look for. So one of the first things I in terms of takeaways, I don't care what you do, enjoy it. And if you don't enjoy it, who's going to know it?
Patient.
The patient. Everybody around you is going to know you. Have y'all ever worked with someone that didn't want to be there? and they came in the morning, oh, here we go again, I'm going to smack them. Because those are the people that really, they don't need to be doing what they're doing. There are jobs out there for everybody. We need to get them there. So as we're trying to build this culture, healthcare people say is not very good. They love to take pot shots at it. It's incumbent on us to change that viewpoint. So when we realize that the everlasting truth of everything changes and everything moves through this culture, we're going to be okay with that. Let me ask a question. Who likes change? Who hates change? So why do we hate change?
The unknown.
It's the fear of the unknown. We haven't been there. Oh my gosh, I like my box, I like my routine, and this is where I want to stay. If you ever get the chance to do your DISC profile, if you don't like change, my suspicion is you're a high S, and those are the people who are very steady, they like the world, don't play in my sandbox, don't mess it up. Healthcare is not for you. Unless you find a role that is very controlled, because it is changing so rapidly. You know, the things that we did 2 years ago, we don't do today. And so if you like change, and if you're perhaps a high D and a high I, you're going to love healthcare. It is so much fun. If you're the S, look for something that's controlled. And I also happen to believe, and I don't think I put this in here, if you get a chance to pick up a copy of Liz Weissman's book, Multipliers. She was here on campus about a year ago through the Eastman series. And what she says is, her basic premise is, if you like what you do and you're using your strengths, and you're the kind of person that can engage people, you multiply what goes on. Now, she also talks about those people out there who are killers, and they're the people who just, they can suck the life out of a room. They either A, don't like what they do, or they don't pull everybody in this change and pull everybody together. So it's a good read. I highly recommend you get that. Point is, healthcare is constantly changing. If we have a basis in a culture and we know why we do what we do, you're going to be okay to navigate through that. In my 24 years with Mountain States, I've led the marketing department. I've established a physician recruitment arena. I've built a management service organization, not me, but we, but a part of it, management service organization. I've had operational experience in the facilities. I've worked in the service excellence, patient satisfaction arena pretty diligently. I've moved to organization development. One of the reasons we developed the role that I have today actually is two reasons. Number one, I'd like to think I've got some skill sets to help people, but the second is barrier busting. I've been around since God made dirt, so I can tell you who did what to whom and how we can move through that. So if you think about rapid changes, we are changing at warp speed. And it's not that you need to hang on to what you had here, it's a foundation and you move forward. One of my current fun things I get to do is working with our lean journey. We call it value optimization. And so if you follow lean and you think about process improvement and really radically changing what you do, we put 10 people in a room, we have rapid improvement events, and sometimes we just change tremendous stuff. James is here today, and he's one of those leaders in that arena. We change all kinds of processes. How does that feel to people when we change their process? Good or bad? Oftentimes it is bad because it's that fear of the unknown. However, if we just keep moving through, we can get there. We know that change is inevitable. We are going to be able to get there. So if you think about transformation, where healthcare is, what you all need to do, it's almost we need to be prepared for the biggest challenges as we move forward, and it's excellence in care. Very much so. Obviously, I didn't write up these things. I just pulled them out. Michael Porter, Redefining Healthcare. Porter actually has done some of the seminal work in strategic planning for healthcare organizations. Been around for a long time, worked at the Sachs Group. Great individual. So intelligent, he's almost formidable to have a conversation with because his mind's always doing this. But one of the things he says is if we're going to do something in healthcare, we need to strategically think about what we're doing, and then we need to move in that direction. So let me ask this question, put it in your context. When you chose the College of Public Health, did you want to be a basketball coach? No. Did you want to work in retail? Probably not. What did you want to do? Come on.
Work in healthcare.
Pardon me?
Work in healthcare.
Work in healthcare. Improve healthcare. Do something around healthcare. So you strategically chose the College of Public and Allied Health to do what you want to do. In healthcare, God bless you, in healthcare sometimes we exist, or we have existed because we just knew we needed to. Oh, you're sick, we have this person for that. You're sick, we have this person for that. Well, what Porter says is as leaders, we need to kind of take a step up and be more strategic about what we do and how we get there. And we can get there. The Parade magazine, How to Stay Safe in the ER. Everybody knows somebody whose cousin was in the hospital and then had an infection after their hospital stay. Right? So then what's the supposition there? What's their first thought? Where did they get the infection?
Hospital.
In the hospital, absolutely. Did they?
Maybe not.
Maybe not. And so if you think about all the popular media out there, you can pick up a newspaper anywhere in the country and it might say hospitals kill people or cure people. Which one? Kill, because cure would never make the front page of the newspaper. And on the kill side, it's perhaps a little bit of truth, but not all the truth. And so one of the things that I think that was a real aha moment for me is understanding, when I say, oh, I work at the Johnson City Medical Center. I work in healthcare. I'm making lives better. Sometimes people go, bull. Because to them, all they know is what they've heard or what they've read somewhere. And we tend to be in an environment where we make those second guesses, just like I made those second guesses with Josie King. We tend to make those second guesses. So you have to be in it for the long haul. It has to be okay for them to say, oh my gosh, I would never go to that hospital. My second cousin twice removed, they got an infection there. Now when I hear stories like that, my first response is always, gosh, I am so sorry that he had that happen in his life. Then, because I can't let it go, I always say something like, infections are everywhere, and I know he was in the hospital and then perhaps had an infection, and sometimes it happens outside the hospital as well, and it is so important to all of us. Let me tell you some things we're doing because we think this is a huge issue. Notice I'm never saying, couldn't be with us, although our rates are some of the lowest in the country. So if you think about how you talk to folks and how you want to resonate through that, yes, they have horror stories. It's not always the defense on their horror stories. It's what can we do to help them learn and understand. I mean, it's everything from, gosh, have you been in the hospital lately and seen those alcohol gel things? Have you used them? Well, I've seen them, but I haven't used them. You ought to. This is why they're there. The other thing I always tell nurses and folks, if you work in a healthcare setting, let them see you wash your hands or dry your hands. I don't care if you wash them outside the room and go in and start to dry them off. Let them see it. Because then they know that you care about them and what's important in their safety. We, knock on wood, haven't had wrong site surgeries. But one of those things out there you see is the fear of wrong site surgeries. Well, one of the national patient safety goals to prevent that is what? Do you guys know? Or do you know what we're supposed to be doing?
Hand washing.
Hand washing for infection control. What about to prevent wrong site surgeries?
Marking the site.
Marking the site with a big old magic marker. And so, just when you do that, some people go, well, if my surgeon doesn't know which part of my body to operate on, I don't need to tell him. So why not make it a little fun? Hey, you know what? You're going to have surgery tomorrow morning. We're doing this because you always need to tell them, it's a national patient safety goal. Write your surgeon a little note on your arm if that's the one, hey doc, cut here, or not here, stupid. And so when you do those things, patients become involved. Patients become involved. So if you think about how we move forward, and we're talking about excellence, if it's us doing something to someone, there's a third party there. It's you did it to me. If they're involved in it, it's a little different scope. So again, as leaders, we need to help set the rules. And again, national patient safety, huge goals. There are national patient safety goals that we have to follow or are supposed to be following. And instead of just following them, tell the patient. Here's another one for you I think that's important as leaders to think about. No one cares about what you do until they know why you did it. No one cares about what you do until they know why you did it. Wish I'd written that, Simon Sinek did. But the point is, if you can tell people why you're doing something, it starts to resonate. So we have electronic health records now. And y'all, out there you've used them. And on your armband, there's a barcode. Now, if I came into your facility and you put a barcode on me, one of my first thoughts might be, I'm like a banana at the grocery store. like a piece of produce going through. And every time they come and do care for me, do something, they swipe that little thing and it beeps. So that just, again, connotes that I've just went across the scanner. So why not tell somebody, do you know why you have that barcode? Let me tell you the coolest technology we have now. And you show them what they do. It doesn't take any longer. You're going to be swiping it. You're going to be putting something in. But when you tell them and you show them, then national safety goals mean something to them. And it means that we're caring for them. Remember, no one cares about what you do until they know why you did it. Again, article after article about hospitals and what's going on in healthcare. And it makes all kinds of media out there. So if you think about where we are today, Albert Einstein said that the problems we face today cannot be solved at the level of thinking we had in the past. What's that adage that we say, just doing the same thing over and over again is the definition of?
Crazy.
Insanity and craziness. So if you got a C on a test, and you studied the same way the next test and you got a C, and you studied the same way the next test and you got a C, what does that tell one?
Something wrong.
You're doing something wrong, or you're a high S and you're not going to change your process. So if we think about that and we start to think about it differently, we're not going to solve healthcare problems today and in the future like we solved them 10 years ago. When I first started healthcare, I had a huge budget for marketing. Did we have fun? Holy heck, we had fun. We were doing events, we had trinkets, we had all kinds of stuff out there. We did institutional advertising. We really, it was like all of a sudden, nirvana had happened in healthcare because my background before healthcare happened to be communications and marketing and advertising. And so we were really getting to build campaigns and we were really moving forward. Today, the marketing budget is like, 1/100th of what it used to be. And it's that way because no longer do we need to spend money on that. We need to channel something differently. James, I'm going to pick on you for just a second. So VOS in healthcare, give me a 2-minute elevator speech on what lean thinking is, or give them a 2-minute elevator speech on lean thinking.
On what lean thinking is? Mm-hmm. It is a growth strategy for any industry. And right now in healthcare, there's a big push to lean problem solving to help get a lot of the waste redundancy out of our processes so we can deliver better care to our patients and to our team members as well.
Okay, so lean grew out of manufacturing, and it was a way to reduce variation. And so if you think about a manufacturing widget company, and I look at the same process over and over again, the way I win is to remove as much variation as possible. So it's bring efficiency, make it all that better. So about 2 years ago, we started our lean journey inside healthcare. Now, the minute you start to think about lean in healthcare, does every patient respond the same? Is every healthcare issue the same? Not at all. So we're trying to remove as much variation in the process so that we can get the same outcome and at the end of the game. Now, a lot of people have said, you can't do lean in healthcare. Can we?
Yes, we can.
Oh, yes, we can. Absolutely. But it's having a vision towards something that is standard work and standard process. Now, the reason I mention that is 5 years ago, 10 years ago, if you had 300 members of your medical staff providing care and every physician is a little bit different, want to provide their care a little bit differently, then we would change our processes to meet them. In surgery, we had volumes of preference cards, so we could pull them out, we could tell them what surgeon X wanted, what surgeon Y wanted. All those things were important to us. Today, we're trying to grow more towards evidence-based medicine and standardization. So if you think about vision and lean and standardization, what you have to do in healthcare today, where we have to get and go, is make it more like my S's in the room, who like things steady, who like things process-driven, who like things moving in that same direction. That doesn't mean we're not going to change them, but we're going to get the optimum way to deliver that. Well, again, 10 years ago, we would never have done this. A lot of our rapid improvement events now are simple things like where are the supplies located? Because if you think about that, then if you go to one place to get a supply and it's not there, you go to a second place to get a supply, it's not there, you go to the next place to get a supply, it's not there, it's a waste. And there are 8 wastes in buckets out there in most operations. So you want to remove as much waste as possible. The other thing about lean thinking, and it fits so well with our organization and with a lot of organizations out there in terms of patient-centered care, is the patient or the customer defines value. And that's a little different Because in the past, in healthcare, we have defined the value, and the customer has just had to come and get the value. Now we're asking the customers to define that value. And when you ask them to define it, and we have to listen to them, hang on to your hats. It's one of those things where, if you haven't noticed, I'm a talker. So when I'm in those situations, I have to almost sit on my hands and bite my lip because I want to so badly give more information. That's not what I need to do. I need to listen to them and have them tell me what's valuable. It's a hard lesson to learn because we do all these things out there, all these really cool things, and we think they're phenomenal. But if the patient doesn't think they're phenomenal, are they? Not at all. So if you think about you all, who you're going to be serving, and your customers, if they don't find value in what you do, then you have to ask yourself the question, why am I doing it? Very different from where we used to be. So one of those things in terms of leadership in healthcare today is we're listening much more than we ever did in the past, and we're trying to make changes based on them, not just us. A couple of just basic core tenets about leadership, and again, we could talk all day about different topics, is I think that healthcare leaders have to be values-driven. And values-driven really set your core. Inside our organization, we have actually 4 core values. It's integrity, service, leadership, and excellence. They sound kind of benign. If you put the acronym together, it's ISLE. And you think about an island or an isle, it's something where there's lots of turbulent waters out there. It's got a grounding, it's got a base, and it's going to be strong no matter what's happening around it. And that's one of the reasons we chose the acronym, and it worked for us. However, here's where I think it's pretty cool. I can't tell you how many times you're faced with making a decision, and you look at someone and say, does that fit into our values? Is it honesty in everything we do? Is it leading with integrity? Is it service? Are we pursuing a higher standard? And when you do that, it helps refocus what you do. So values are important to us. Our breadth of customers spans 4 generations. And if you haven't had this lecture yet or had this conversation, think about this. Today, there are 4 generations in the workforce. And in those 4 generations, it's everything from the millennials over here all the way over to the traditionalists over here. And so my millennials grew up with technology. To them, a smartphone is the best way in life to communicate. They want to get the information in short snippets, give them podcasts, give them all kinds of information. If you can tweet it, that's good for them. To these traditionalists, generally speaking, that's not the way they like to get information. Millennials would be fine with something about healthcare on a smartphone. Traditionalists want to sit down, and they want to tell you every last detail about every bowel movement they've had in the last week. So again, if you think about that whole breadth there, we have to figure out how to serve them. So that breadth of customers changes. What we have to do is we have to change with them. And we have to be able to deliver that kind of information. So if we think about demand and supply, etc., it's important to think about those folks who are out there. Jim Collins, who wrote Good to Great, again, another good read. I would encourage you to read it. The first line of his book says that the enemy of a great organization is a good organization. The enemy of a great organization is a good organization. And so he challenges folks to move to the next step. Or moving to the next step for him goes through 5 levels of leadership and getting to that 5th level leader, that you really are listening to your customers. You're serving others. And I know y'all know this, but in healthcare, we are serving others. At its simplest, we're making a good living. We're having fun. We're going to do the things we want to do. We're going to improve processes. But at the end of the day, we are serving others. And if you think about that concept, it kind of helps drive where you want to be. And so Collins says, there's all kinds of sectors out there you want to go through. But in healthcare, really think about who we're serving, why we're serving, and what's important. You see icebergs a lot in terms of competencies. And so for leaders, skill and knowledge is what people are going to see. That's what they're going to know about. The rest of the story is you. And I can't tell you how many leaders that I've talked with who are so good at this, but they're not as good at this. No one cares what you do until they know why you did it. If you're a values-driven leader, they know about you. I have kids, some of your all's age, they're almost 25 and 26, and trust me, a fate worse than death is being one of my kids, because they will tell you it's just not fun living with me. However, one of the things that I have told them forever is that whole thing about the dash, and you've heard it before, that if someone's standing over you and talks about your life, it's what happened between your birth year and your death year, and the dash in between. And it sounds kind of cute, and it looks good on a card. If you lead thinking that the worst thing you do is what people are going to talk about, every action you do can wind up on the front page of the Johnson City Press. Today, it could be Googled and viral in 4 or 5 seconds flat. And you ask yourself the question, is that what I want my mother to see? It's amazing how it drives you as a leader. It is amazing how it drives you as a leader. So I think values-driven leadership, if you go below that thing, the behaviors, the attitudes, if you believe in what you do, you're going to be successful. If people know why you do it and it's a values-driven decision, you're going to be successful. You're going to get them there. You can give people all kinds of data, and we're really good at data. We're really good at data. But data is bunk without the rest of the story. And so we can give all kinds of statistics, etc., but until we connect with some sort of gut concern and it resonates with someone, you're not going to get where you need to be. Kind of hard to read, so I'm going to go there. Suffice it to say that there are 3 domains that I think we as leaders have to think about. We have to think about our skill sets, and those skill sets turn into competencies for us, and those competencies are what we're really good at. If you put me in front of a computer screen and said, Tom, this is what I want you to do. You're going to do spreadsheets all day. You're going to do these reports, and here's your metric for success, and it's 8 o'clock now. I'll see you at 5 o'clock. By about 9:15, I'm going off the deep end. I have to have people. That's not my skill set. So you think your skill set, can I do spreadsheets? Yeah, I did them. I know. I took the classes. I can tell what all those metrics mean and what you do to move them. But the competencies for me are what you do with them. Now, if you happen to be a person who's doesn't crave people all the time, you probably love spreadsheets. I have a very dear friend. We're very different. But I can't tell you how many times I call him and say, I'm stuck. Help me here. Where he can do it like this. And I'm always just enamored at how fast he can do it. And I'm always saying, oh, this is wonderful. You're so smart. He's like, calm. I couldn't do this, but this is what I'm good at. So it kind of goes back to what I mentioned with Liz Weissman, the multipliers, and finding what you're good at, do what you're good at, and leverage those competencies. The third wheel there in that circle was where you use your talents. You all will be able to use your talents very much so in very many aspects of the healthcare industry. And I guess since this is a healthcare class, I have to say I hope you end up in healthcare. But you know what? You can take everything you learned here into another industry and use it in that other industry. I didn't start out in healthcare. I started out in retail and advertising. Very, very different from healthcare. But was it? I mean, I grew up thinking, let's focus on key customer requirements. And those are the things that the customer has to have. And then what do you do with those key customer requirements, and how do you build processes to give them what they're looking for? Well, that kind of gets to the process improvement as we're going through. So you can use all of those activities in multiple skill sets. Another way to look at it, if you think about you all as leaders, you're going to go into an organization, you're going to be managing others. And as you start to managing others, then you start managing other leaders, and you'll go up to that executive level. As you go through that chain, your skill sets change just a little bit. I sincerely hope that you don't. Because if you're good down here and you resonate with people and you're leading for the right reasons, then by the time you get up here, you're going to be the kind of leader that people like to lead, that want to follow. Who are the leaders that come to mind? If I said great leaders, who are they? Give me some names. Gandhi. Abraham Lincoln. George Washington. Okay, I've heard from this side of the room. Come on.
I think the Boy Scout leader I had.
Okay.
Kerry Dickerson. He was my Boy Scout leader, and he was my mentor in healthcare.
So it's a person who was not nationally profound, but regionally profound.
Now, Dennis was, you can't not remember what, It's legendary leadership here.
Yeah, we just lost our CEO after 24 years at the helm of Mountain States, and an incredible man. I learned so much from him and enjoyed working with him. Very much had regional and somewhat national prominence. Didn't start out that way. So whether it's Gandhi, Abe Lincoln, the Boy Scout leader, a local CEO, a college leader, all those leaders have something in common. And what they have in common is there was a belief system somewhere that they had, and they stayed with that belief system, and as they moved through their ranks, you didn't question the belief system. Anecdotally, when we started our patient-centered care journey, I mentioned we decided not to purchase the franchise. There were 14 of us got on a chartered plane that we thought was going to be a jet, but it wasn't. It was a prop job, and we traveled the country. I wouldn't recommend it. But we traveled the country looking at high-performing hospitals who did this thing really well at putting their arms around this patient experience. And we saw some phenomenal places. And we saw a couple that had great brochures and it looked really good, and we were so pumped about going. And when we got back to the plane and we started debriefing going to the next place, it was like, didn't feel it. I didn't get there. Now, I also have to make this disclaimer. We've been on our patient-centered journey inside Mountain States for about 12 years now. Are we perfect? Absolutely not. Do we mess up in that experience every day? Absolutely. The intent is there, and it's there from the highest level of our organization, including our board members, but we still got our journey to go. But if you access a Mountain States facility, your experience at JCMC, at Johnson Medical Center, is going to be different from your experience a mile down the road at Franklin Woods. Different people, different setting, different environment. Our goal has always been, how do we make it as similar as possible back to some common core values and what's important to us. So some critical success factors for you is you have to have a shared vision. I mentioned Liz Weissman earlier. Absolutely. If you're going to be a successful leader and you have a vision and you don't share it, no one's going to know. My kids just finished their masters. What's my vision for them?
Be happy and successful.
Oh, that sounds really altruistic. Be happy and successful. What's my next vision?
Use it. Self-sufficient.
Use it, self-sufficient, get a job? Absolutely. Now, I do want them to be happy and successful. And so when we talk about what you do, it's choose something you like to do, yada, yada, yada. However, the whole journey has never been, okay, you're going to go to that class because this is what's going to get you. My vision for you is to be self-sufficient. Get off my payroll. And I say it just like that. However, over time, they know. I bet your all's parents, the people who are helping you here, they want you to be self-sufficient. They want you to be happy and do what you're doing. So that vision, you have to share it. And if you never share it, then no one knows. One of the things that I always tell managers, new managers especially, when you start to lead a team, the organization has a culture. The organization has policy and procedure. The organization has all this framework in place. The team member is not going to connect with the organization. It's up here. Who do they connect with? Their Boy Scout leader, the person right above them. So if you start to talk about your vision and you use all that, but you talk about your vision for your team, it's amazing what can happen. So when you think about shared vision, you have to share it often. There's an accountability piece, and I think we use accountability far too often. Well, you're accountable for that. Well, you're accountable for that. Well, that's your accountability. Accountability is shared. If I'm giving you a message, I'm giving you a message today, and after 45 minutes having listened to me, I hope that there are a couple of key takeaways, which, by the way, I'll tell you at the end just to make sure you can remember them. But those key takeaways, I'm accountable for delivering that message. You're accountable for listening to the message. So anything we do, there's an accountability factor. Accountability is not, here, go do it, you do it, good luck. We share that accountability. And one of the common pitfalls in leadership as we think about it is sometimes we think, I'm just going to give it to somebody else and now they're responsible for it. I'm still accountable for it. So in healthcare leadership, as we move through the future, we have to make sure that we have that acumen. We have to be able to evaluate information. And then that commitment of resources, time, and energy. If you think about the best professor you ever had, and some professors in the room, I don't want to step on your toes, but the best professors we ever had, were they always the smartest? Who were they? Weren't they the people who really committed to us? I mean, they wanted us to learn, the people who spent time with us, the people who made it so that we could get what we needed. Those are the people I remember. I had two in undergrad that were phenomenal. One was the national marketing director for Coke International and then came to teach at UT. And the other one was a lady who was really good at public relations and public relations campaigns. Now, theory, I learned no theory from her, but I got so much pragmatic knowledge, but I got a lot of her. I got her time, I got her energy. Those two people really framed a lot of what I think I was able to do in using the rest of the skill sets. So as a leader, you have to be committed to give time, energy, and resources. And if you enjoy doing what you do, then that comes very, very easily. Another Jim Collins book, Just Greatness is Not a Function of Circumstances. It turns out it's a choice. Greatness is a choice. Do you want to be great? Yeah, I think you choose to be. Go back to me for just a second to the people who suck the life out of you. If you work with someone and every day is a Debbie Downer day, everything is awful, it's always nothing's ever right, they did this to me, I'm the victim, this happened, are you going to be great? I'm a firm believer, hang on to your hats for a second, I'm a firm believer that when the alarm clock goes off, if you can't hit the alarm clock and say, "Good morning, world, I am so happy to be alive, I can't wait for the day," I strongly encourage you to think about what you're doing. Because if you hit it and it's, here I go again, got to go back to work, hate that place, I hate those people. Your patrons are going to know, your coworkers are going to know. If greatness is a choice, and I do believe that there are things that we have to have come together, but if greatness is a choice, we choose to do it. We choose to be that way. We choose to have that kind of a personality. And that doesn't mean everybody's like us. I slung pizzas in high school with a guy that when I walked in one day said, right, very true, if you smile one more time, you're eating this pizza pan. And my first thought was, that's going to be interesting. I wonder if I can get my mouth around that pizza pan. But what he was really saying to me was, you are on my nerves so bad, I can't stand it. Now, he was on mine too, but I chose not to tell him that. The choice there, though, is what do you do with it? And when I was in high school, I did all the wrong things with it. The minute he said that, what did I do all night? Oh my gosh, I was the happiest person ever. I was on his nerves and in his face all night long and enjoying every last moment of it. All the wrong things to do. Because if we were going to be great, what did he need me to do? A little too much Tom. I need to back off just a little bit. In that way, he gets what he wants and I get what I want. One of the true hallmarks of a leader is understanding that. You're going to work with people who are people. You're going to work with people who are not people. You're going to work with the people who are just perpetually perky. You're going to work with the people who are not. And we need to help them move through that. So greatness is a choice. We choose to help ourselves, but we also choose to help others. Healthcare is in crisis right now, and I do think for leadership we've got to put our arms around that. We've got to go back to what I call some of the basics and then continue to move forward. And so the last thing I'll tell you about that is all of this is going on in our population today. You all have studied it. You know all the stats about it. You've looked at it. You know it's an issue. You know, it would be real simple in the United States if we would just all follow healthy behaviors. We'd all be out of a lot of jobs because we wouldn't have to worry about it. But that's not going to happen. So if all this is going on, the high cost of healthcare is going up. By the way, do you know that in terms of waste in healthcare, statistically speaking, studies say that the waste in healthcare on all of these issues today is greater than, dollar-wise, the entire defense budget for the United States in a year. We waste more than the Pentagon spends on keeping us safe. If that's what we need to be doing, then we need to make sure we're moving kind of back to the basics of leadership. So what does that look like? It's these acumens right here. The first is a knowledge of self. In a knowledge of self, it's me as a person, What am I good at? What am I not good at? What are my strengths? What are my opportunities for improvement? Because I don't like the weakness word. What can I do to improve? It's looking at how do I act and how do I respond? Who do I want to be? What people say about me? And again, I am not the brightest crayon in the box. I've known that for years. But I am always me. And I think if you talk to someone who worked with me 10 years ago to now in different arenas, that what they would tell you is, that's Tom. I can always count on Tom. Not that Tom's the smartest one and Tom has all the answers, but that's my personal brand. And you all will have a personal brand. Safeguard it, build it, have a knowledge of yourself, what you're good at, leverage that. Liz Weissman's book, Multipliers, get it and read it. Next is the financial acumen. We have to have that. We know it. So you've spent lots of time in class learning about different reports, how to use them, what happens with them. It's not that you know how to prepare the report, it's that you know what to do with it. So depending on where you go, you may be forced someday to look at a report and you go, I have no screaming idea what this is. Find out what's there. Understand what's going on with the financial acumen. Human resources, I spent probably more time this morning talking about connections to people than anything else. We're in the people business and we're people caring for people. So if that's true, then that means that we have to respond that way. So the whole human resources to helping people grow, become leaders, learn new skill sets, be happy. What's happening at home? How can I help you with that? All of that's incumbent on leaders and in any organization, not just healthcare. We have to be critical thinkers, and I will tell you that I think that's one area that all of us could spend some more time in, is learning how to critically think. Because we're really good as long as it fits the model and fits the protocol. But the minute you go to a downtime procedure or something doesn't happen, oh my gosh, now what? And that's coming back to those fundamental, what do I need to be doing here? And it's different for every role and what's going out there. Everything from the person who's on a manufacturing line over here, if something's coming through with a defect, you don't just let the defect go through, you pull the cord, you stop the line. You don't just let the patient go into surgery if we don't have X, X, and X. When we know those things, but what happens when the procedures start to go awry? How do we get around there? Critical thinking. Strategic thinking, life happens. The sun comes up every single day, which is a good thing. If life happens and the sun comes up, don't just be strategic about organizations, be strategic about you. And I've met with people who are far better than I am about saying, you know what, here's my career goal. I'm going to graduate here, and then by here I'm going to have this, by here I'm going to be doing this, by here I'm going to be doing that. Now decide what metrics are important to you. It may be a function in an organization, it may be a salary, it may be living in a certain place. All that's a part of your strategic plan. If greatness happens and it's a choice, you can choose to start to follow it. It doesn't mean that it doesn't change, because you'll change it often. I had no screaming idea I would be in healthcare when I was in college. That's the first, if you'd mentioned blood and guts and other stuff that comes with healthcare with me, I would go, I don't think so. Not this kid. It's been the best ride ever. So as that strategy changes, and as we change, that will also change as well. But be strategic about what you do. And the other thing I'll say about that is be strategic about everything. If you start a class, be strategic about it. If you start a new job, be strategic about it. Know what the metrics for success are and hit the metrics. Because whether or not we think they're important, if they're important to the organization, they're important to us. So very, very important. Customer focus. Wow, I could spend semesters talking to you all about customer focus. Suffice it to say, I can think I'm wonderful. Like that Stewart guy on Saturday Night Live, I'm wonderful, I'm good. As the other person doesn't find value in what your organization is doing, what you're doing, then it's not really, you're not meeting their requirement. Their needs, their wants, and the whole nine yards. So those key customer requirements are important. The Baldrige program was mentioned just a second ago. One of the hallmarks of the Baldrige program is key customer requirements and focusing on the customer who you serve. So I had the good fortune to spend some time with your friends over in the College of Business on an advisory council. We talk about their programs. And one of the things that I think is important is you all don't come to school for a piece of paper. You come to school because it is a means to a living and a job for you. So it's to learn a skill set. So if we're all going to be relevant, it's not necessarily the curriculum, It's does the curriculum prepare us to be successful once we leave the university? So placement rates is the real metric and outcome. It's not necessarily this over here. We're the same way in healthcare. Sometimes we target the wrong outcome. If it's customer driven, then think about what's the customer doing here for it. Absolutely, that's where you're going to go. Think of the restaurants that you like to go to, the sit-down restaurants you like to go to. Your customer requirement is the experience. It's not the rest of the story. I'm going to go over, but I have to tell you a 2-minute story because this is a Tom story, but there is a point to this. About 2 weeks ago, Ash Wednesday, whenever Ash Wednesday was, you'd worked all day, ran to church, did Ash Wednesday service, and on the way home I called home and said, I'll pick up dinner, what does everybody want? And they said Zaxby's salads, not a problem. So I go through Zaxby's, and I ordered my salads. Now after I had paid, they said, it's going to be a few minutes, we're going to put some chicken on for you. Okay? So they say, will you pull up? Now, if you go to a fast food restaurant, what are your key customer requirements? Fast. 21 minutes later, they come out with my salads. So I'm already kind of a little agitated, and I'm doing emails, I'm on the phone, it's now 9:30 at night, everybody's at home texting me, are you coming home? Did you get, yada. So I'm making my salads, and they say, I'm so sorry you had to wait, here's a brownie. Bingo. There were 5 salads ordered, but there was 1 brownie. Thank you so much. It's not your fault or else it's in the night. Thanks so much. Have a good night. So all the way driving home, because I think this way, I was thinking, man, that is a key customer requirement, just not hitting it. Because they need to understand fast food and key customer requirements. I'd love to talk to the manager of Zaxby's. And then I thought, stop it, Tom. So I go in the house. I have 4 salads, not 5. Now, at this point in time, I've had it. And I was not the perpetually perky nice Tom. I get my receipt, I get back in the car, I Google the number, and I call. I love Google. Google the number, and I call, and I say, this is who I am. I was just through your line. I was the car that you made wait 21 minutes for my salads, and I'm now short a salad. I'm on my way. You have 3 minutes. When I get there, my key customer requirement is that you're going to have my salad ready because that was my requirement the first time through the line. And I was sitting just like that. Now I know that the person on the other end of the phone was thinking, what a jerk. I don't know who you are. So he apologizes. I'm so sorry. I'm the manager. I'm the person who packed your bags. It'll be ready for you when you come through the line. So I get to the line, and the little girl opens the window. I said, hi, I called. I was the person who was short a salad. She said, hold on, the manager wants to talk to you. And I thought, okay, here it is. You've been too much of a jerk, Tom, and he's going to give you a piece of his mind. Well, he sticks his head out, and he's been a student of mine. And he said, I knew that was your voice. The minute you said key customer requirement, I thought I've heard that before. And he said, and you're right. We just messed up. And I said, I am so sorry, because I was really embarrassed. However, the key customer requirement was fast food, right, and good. Our customers respond that way. And I was a customer. I was just an average customer who was upset about it. I just perhaps couched it differently. So when we think about customer focus, we don't exist to serve us. We exist to serve others. And when you put your arm around that from a leadership standpoint, particularly in healthcare, it's not the it that we do. It's what do they think about and do with the it that we do. The other acronyms are important, certainly process improvement, and again, a couple of days to talk about. And then innovation, we do need to be innovative. So if there's any point to my rambling this morning, and I just pulled stuff from different presentations, it's understand healthcare is changing dramatically. If we're going to be relevant and if we're going to be successful, we have to change with it. We have to have this basis, but we have to be willing to understand those 4 generations in the workplace. We have to be willing to understand those 4 generations of customers. We have to be willing to understand that we have to change a little bit, and we're here to serve others. We have to be willing to understand that our product is oftentimes not what we think it is. It's what they think it is and what they do with our product. And the last thing I'll leave you with is, please, please, please understand, everything you do speaks. It is you. It is your personal brand. And so if you're going to be successful as a leader or just in life in general, think about your brand, because that's what people will talk about, that's what they'll remember, and they love to talk about the bad. If you happen to answer any questions or whatever.
Thank you very much. Now, wasn't that fantastic? Thank you very much, Tom. Questions, comments, thoughts, agree, disagree?
Feel free to disagree.
Loved it, hated it. What resonated with you the most? Someone had something to say.
Oh, no, my question was, are you guys going to go for national Baldrige? Can we go level 4?
We have actually been on the National Baldrige journey. We've had 2 site visits. Last year we were in, and the Baldrige level, you don't get a site visit until you hit a certain level. So, excuse me, both the last 2 years we have been in the same bandwidth as the National Baldrige recipients. We have a new leader in the organization, so I can't tell you whether we'll go this year or not. My hope is that we do. My belief is that we will continue to use the framework and the criteria. And you all have a national expert as a part of the university. Andy Zucri has been involved at the national level. Baldrige judge, knows it tremendously well. And again, get involved in that program. It's super.
Yeah, well, Dr. Pendley, she is a reviewer for the TNCP.
Great.
Yeah, for Baldrige. So I guess that explains her question.
I like it. We are very committed to TNC, as you know, to TNCPE. We've had probably 40 to 50 people become examiners inside the organization, and we help train some of those examiners. It's just a lot of fun. Good. Please keep doing that. Anything else?
Thoughts, comments?
Anything I say just sound like bunk.
I have a comment. You were recommending the book Multipliers, but you also had a lot of quotes from The Good to Great, Jim Collins, and I've read that book, and it's phenomenal for anyone who has any managerial or future leadership preference. I would also recommend getting that book. It's called Good to Great by Jim Collins. Phenomenal.
It is. The other author I didn't pull out was John Maxwell, and John Maxwell is a servant leadership bent, and again, follows closely with some of the Collins stuff, but just good stuff. By the way, the Chick-fil-A LeaderCast this year, which is held at Eastman, well, it's no longer Chick-fil-A, it's just LeaderCast. Simon Sinek, John Maxwell, several folks are going to be on that docket. And at the first blush you think, oh my gosh, I can't go to an auditorium and watch somebody on a video all day. Phenomenal. So I would highly recommend that you look into that. It's it's in May. I think it's May the 3rd this year.
I think Tom, you also mentioned Michael Porter's Redefining Healthcare, and actually it was my colleague, Colin, who ordered the book recently, and he was kind enough to let me borrow it. So I have it. If anyone is interested in, borrowing the book and going through it, I have Porter's Redefining Healthcare in my office.
It's a great read too. Really good on strategy and makes you think, why are we doing what we're doing? Okay.
Well, thank you again very, very much.